Fine. Okay, chicken. You go ahead, please go ahead.
I have been practicing since last 15 years. I am running my own clinic by the name of Healthy Living Physiotherapy Clinic in Faridabad. It's a 6-bedded clinic. Previously, it was 3-bedded. So it's been almost 4 to 5 months that we have made it, expanded it to 6-bedded now.
Excellent.
I practice daily affirmation, morning affirmations. Positive affirmations in the morning. And I think I am blessed by the universe that I came across the $10 growth program. And I really feel blessed by the universe that I enrolled in the program. And I have seen a lot of changes in the last 4 months.
Right.
So the journey of the learning has been excellent in the last 4 months, though it was little hectic for me. But yes, the learning was excellent. It was, I can say, the ocean of learning. Each day, though it was going hectic, but there was something which was, motivating and, raat ko 2 baj jaye, something was,
Very true.
motivating. There was some food which was motivating. Each day was a learning. Each session was a learning. One session gets over, the other is more interesting and more learning. And might be the time challenge was there, which sir, I discussed with you also, if you remember, that I am not able to manage with the time. Yeah. But you motivated me, and actually it helped me knowing my potentials. Otherwise, perhaps I was finding it difficult. Right. But I pushed. I will say across my potential. And
you told me that next day your son. I think you were on holidays and you came on that thing, right? Right. I know. And I had given an example that अगर कल मॉर्निंग आपके बेटे का एग्जाम रहेगा तो फिर क्या करोगे आप? Yes. Yeah. I remember.
So basically, what was the motive for you to say that? Now we understand.
Correct.
For commentary, frankly speaking, I felt a little bad also. Yeah. But everything has a meaning behind what is being said by the mentors that perhaps we realize later. So we push our potentials only when, otherwise we don't push.
Correct. Very true.
Sir, there were certain challenges which I was facing being a practitioner. And I think most of the physios face. One is the prescription-based practice.
Yeah.
One thing which is actually hampering the growth of all the physios, I'll say.
Right.
And the topic was beautifully taken by ma'am, how to deal with that issue.
Yeah.
Though I was also not practicing it fully, but yes, sometimes like patient is adamant and so thoda sa kar lete the. But the way ma'am explained how to deal with it, now it is like 100% no. If a patient does not understand, I leave the patient. I try to maximally educate the patient as explained by ma'am, and most of the time I'll say 90% because sir, you remember aapne kaha tha ki wo confident, if you are confident, your confidence speaks on the and it will be shown on the face. So if you are confident, you say no confidently, the patient's knowing converted into yes.
Yes. Very true.
Correct. So one challenge was that. Second challenge was how to ask the patient for a complete rehab. Even when we explain, you have to come like before enrolling in the program. Now there is a different scenario. Even if we used to ask the patient to come for a longer period of time, many patients used to drop. Perhaps the communication gap was there. Perhaps we were not knowing how to communicate effectively with the patient. And the topic has been beautifully taken by ma'am and you, sir. So now it is like we know how to speak, what to speak, when to speak what. So it is like we are very clear on that. So we are not worried asking the patient for the entire rehab, whether it is a 1 month, whether it is a 3-month rehab. I'm very confident now, and perhaps seeing that confidence, patient also is confident to pay and come for
right.
Long sessions. For a longer period of time.
Good.
Another challenge was like patients saying, "आपके तो prices ज़्यादा हैं." Perhaps many physios are facing this issue, but saying the पेशेंट को वैल्यू ऐड करके बताना, जैसे सर ने आपने एक सेशन लिया था, उसमें आपने इस सब चीजों पे डील इफेक्टिवली कैसे डील करना है ये सब. नाउ when we show them the value add, now like you will be able to do this, it will help you in this, like there are, I will say ki, like you will be able to enjoy life in a better way, and many other sentences which actually patient can correlate with their correlate with them.
Correct.
With them, so they get ready basically.
Right.
So that change also has come, and people, one more challenge was like people call, first question is, "Madam, charges kya hai aapke?" Sometimes it becomes really irritating. It used to be.
Very true. Very true.
I think that is one biggest challenge we all are facing.
Yes.
But now we know the strategies, we know how to deal with that. I won't say 100% I have been successful in that, but I can say yes, to a certain extent, great extent, yes, able to face that problem and solve that problem, I'll say.
Right.
And next thing, sir, I'll say the transformations. I'm more confident now in terms of my practice. I have got a broader vision now.
Yeah.
In terms of the treatment approaches that I follow, and so basically, just say, look, when you're a private practitioner, it is not like physiotherapy treatment is the only thing which will help you to grow. There are, from the time we get the call, it begins from that.
Yes.
If you're not able to convert the patient, everything, your PT treatment won't, because patient is not coming only.
Right.
So basically, from the time getting the call until the time we discharge the patient, even after that, follow-ups, home program. So the entire journey, each step of the entire journey has been beautifully, I will say, made in the form of various sessions that you and ma'am have made. And I will say I really fall short of words to explain the beauty of the program that you have made. This great program. And many other things, ma'am and sir, like effectively communicating with the patient, then HR sessions. I'll just share one incident. Therapists बहुत जल्दी sometimes they switch their jobs. So that is a challenge I think many of the physios face. Currently, sir, I'm having 5 physiotherapists with me.
Excellent.
Great.
Excellent.
Thank you, ma'am. Thank you, sir. So whenever a therapist leaves and you have to recruit a new person, previously perhaps I was not that much, I will say, precise in recruiting the candidate. And once you select the wrong candidate, ultimately you only suffer. So this time, I recently had a vacancy, and it really took me around one month to fill that vacancy because I was not finding the right candidate. And I had used the SIRS selection criteria, which was being taught in one of the HR sessions. And yes, we kept on, following that criteria. No, till the time the criteria will be matched, no matter the schedule was going hectic for me, I will not select the candidate unless the entire criteria is being fulfilled. So basically utilizing all the principles and all the teachings that were being taught to us in the various sessions, I am practicing and I am really feeling the difference.
Excellent.
Great.
So in terms of the revenue wise, where you were earlier and now, what's your current status?
In the terms of revenue also, I've seen the growth.
Yeah.
Because when we patients are coming for the complete rehab program for 1 month, previously which was not there.
Yeah.
So this has the, I will say yes, this has brought growth in my revenues also.
Okay, double, triple, 10%, 1%.
Sir, almost double, I can say.
Almost
Little
double.
less than the double, but yes, the growth has come.
Very good. Okay. So you have one clinic or you have multiple clinics? How is it?
I have one. Currently, I have one clinic. Like
You have
just
one.
expanded. It was 3-bedded previously. Now it is 6-bedded.
6-bedded.
And
Excellent. Excellent.
future, I have plans, but currently I want to focus on this only.
No problem. No problem. Okay. See, it is not necessary that you have to multiply the branches. Even the single branch also can be, expanded, right? In terms of a space, in terms of, the patients, in terms of the physiotherapist and everything. Okay. So that becomes, a better managed also, right? So the cost wise also, it will be lesser than multiplying the branches as such. Okay, so it can be done on both sides. Okay, so one, either multiply the branches, or at one side, you can expand the same thing in terms of space also. Okay, so no worries. Okay, it's excellent actually. Okay, go ahead. Number of patients, in terms of number of patients, what's your number of patients
Yes, yes.
per day?
Previously, it was like around, I can say around 11 to 15.
Okay.
Now it is like 15 to 20 and 20 to 25 also sometimes.
20,
Like
good.
between 20 to 25, previously around 15, sometimes 18.
Right.
So
So make sure that you collect the feedbacks, and you utilize their feedbacks for your that patient expansion. Okay. So because when we talk about 18-20 patients, so there's a quite possibility that you can collect the huge quantity of the feedbacks. Okay, and when
yes,
such the quantities of feedbacks you have, that means content you have, that should be utilized, right? So never think that you are doing it once. In the sense, let's say you collected a patient feedback and you circulate it, right? So you must have seen Facebook remembering your 1 year older the things, last 1 year, previous 1 year, this day you have done this,
yes, yes.
right? Previous posts, exactly they appear after a year as such. Okay, so
Yes,
let's say you just keep sharing. So even if you have around 300 feedbacks, so imagine every single day you will be able to share one feedback,
yes.
right? The same feedbacks can also be shared, right?
Yes,
And it is that's the reason you'll have to put it in the Google, you'll have to put it in the Facebook, you'll have to put it in the LinkedIn. I don't like it, but okay, you can do it. Okay, Instagram. Okay, and make sure that just dial and Practo. Okay, so these are the things where you should take bunch of feedbacks, right? And keep circulating, okay, them on the social medias and everything. Okay, because many people shy away sharing it, but you
yes.
must share it. Okay, its importance now. Okay, you should share it, right?
I
So
also started using the format you had shared, no?
sorry.
You had shared, sir, one format PDF for
Yeah, template.
previously, sir, I was taking the feedbacks, but I had not shared any format. So whatever patient used to feel, they used to share. So
Right.
some feedbacks used to be only either star rating or short feedbacks. Some were long also.
Right.
But now it has helped because the patient knows what he has to write in the feedback.
Right.
So that has also helped.
Exactly. So when everything is in a right format as such, when you deliver that message to the people will be able to take it in the right sense, and they'll be able to utilize it in the right way as such, right? So good. In fact, a nice growth as such, and you have a huge potential as well, right? So when you have 6-bedded, okay, now that can be made 12-bedded also, right? So when you have a 3 physios, now you have a 6. So why can't it be 12, right? So why can't it be 24? Okay, so have that vision, okay, of expanding the clinic. You have an experience, utilize it to the greater extent as such, and make sure that people learn every single day, the way you are learning every single day, and it motivated you to be energized each day. Okay. Similarly, your employees also want that kind of a learning from you, right? And when you give them on every single day, they will feel that you have an ocean of knowledge, and I should not leave you. You're getting it, and you'll be able to retain them for a longer time.
Yes.
Right? Believe me, people don't join for salary. People join for learning. Okay, you must have taken several of interviews now, and if you ask them what is the objective, okay, they'll say one thing out, out of 100, 99 words, 90 from the 99 people, you'll get only one reason, that is learning. Okay, so it is missing in the other for with another people, which you can be able to utilize that. And when you are able to get that credibility, better credibility as such, okay, they'll come, and encourage them also to open their clinics, okay, post probably 1 year, 2 year down the line as such, okay, help them out, okay, in doing it, okay, so that they will also be referring their friends and these things. Arey, yahan pe jao, yahan pe kaam karo, ye acha hai. Okay. So it is just not our growth, okay, they also should be able to grow, and that's how everyone will be able to do that. Okay, it's a very hard to understand that part कि मेरे employees छोड़ के नहीं जाना चाहिए, but accept that as an that's a fact. Okay, so don't be emotional when people leave, okay, because वो बहुत ही pain point होता है. Okay, when people leave, okay, and when people misbehave, and when people live without notice, live without these things and all those things, that's a very, very painful point as such, and because of that, people don't want to expand itself, right? Even we lose our sleep also many times. Okay,
It becomes very difficult when a therapist leaves, because
correct,
workload increases a lot.
right? So they don't see that. Okay, and the problem with an employer is we cannot express our anguish, we cannot express our pain points, and we cannot express how we are dealing with, okay, in a public. Okay, that's a pain point. Whereas an employee can express his frustration, okay, in the social medias and with everyone, saying कि मुझे salary नहीं मिला, मुझे वो नहीं मिला, मुझे ये नहीं मिला. They are very I don't say narrow-minded, but self-centered, right? But when it comes to an employer, we have to see so many things, so many aspects, and wherever we have taken payment and advance from the people as such, so we are even committed to deliver the results on time as such, and without any closing, without any gaps also, right? So it's a huge challenge for employers, but we cannot keep on telling to the world that yes, I have this challenge, I have this challenge, and I have this challenge. Okay, so good things can be shared, but try to avoid the bad things in the public as such. Okay, because that gets inspired to the people. अच्छा इसने ऐसा करके छोड़ा है क्या? तो फिर मैं भी ऐसा करके छोड़ूंगी, right? So that's one, and never ever share the bad experiences of your employees, your past employees, with the current employees. Never ever do that. Okay, we get emotional and we do share when they are joining. ऐसे हो गया मेरे साथ, ऐसे हो गया, उसने ऐसे छोड़ा, उसने ऐसे छोड़ा. Okay, but what happens is कि वो उस टाइम पे बोलेंगे बहुत बुरा हुआ. But when the situation comes to their this thing, और वो जब छोड़ना चाहे, वो ऐसे ही करके छोड़ेंगे आपसे. ठीक है, क्योंकि you have that previous experience कि इसने ऐसे करके छोड़ा हुआ है. Okay, तो उनको टिप मिल जाता है. ठीक है, यस, अगर मैं भी ऐसा कर सकती हूँ, बट सही वक्त आने पे, राइट? और आपने कुछ एक्शन नहीं लिया उसके ऊपर, तो मेरे ऊपर भी एक्शन नहीं होगा. देन they utilize it to their benefit. So never ever share the bad experiences of previous employees with the new joinees or with the current employees. Okay, always share the good things. Okay, always make use of the good examples of your previous employees, how they have excellently worked, how who are all have worked longer with you, how they have benefited you, how they got benefited, okay, by doing that. Okay, make sure this is one point which no institute, आप IIM में भी जाओ या बोस्टन में भी जाओ या कहीं पे भी जाओ, ओके ये सजेशन आपको नहीं मिलेगा, राइट। ये हम लोगों ने बहुत बहुत एक्सपीरियंस है, दिन रात एक करके करने के बाद जो है ना ये लर्निंग मिली है हमें, ठीक है। एंड फॉर द पीपल हु आर एक्सपांडिंग, फॉर द पीपल हु आर taking who are employing people, okay, and in such an unorganized industry, okay, hats off to you all guys who basically are hiring employees, okay, and giving them an opportunity to work, right. So do continue hiring people, okay. If they are unprofessional, it doesn't mean you also need to be unprofessional, okay. So we have to give back to the community as well, right. And that's how hum strong bane, okay. We need to be strong from here, okay. We need to be strong from here, okay. And we need to make sure that everything runs smoother with terms and conditions, not with the mom and pop culture. You're getting it? नहीं बेटा ऐसे कर बेटा वैसे कर बेटा, नहीं, no. Terms and conditions के हिसाब से run करो. Keep a distance, safe distance, keep a healthy distance, okay. Don't get involved in the their personal problems. Don't share your personal problems with them, okay. Make sure you run them very, very professionally, right. So that's how you should be able to do it, okay. Good. And one last point, okay. What is it that you want to share to people who are double thinking whether they should join, they should not join?
Sir, before that, I would like to share my future plans also.
Yeah, exactly. Please go ahead. Yeah.
Go ahead.
Like for the L3 program, very soon I'll be joining.
Most welcome. Most welcome.
You're welcome.
Okay, ma'am. Thank you, sir. And message for the regarding the 10 million 10x growth program. There is no point in thinking about it. Just close your eyes and go for it. It's a magical program which will bring miracle to your life.
Right.
That I can assure you. That miracle in my life.
Exactly. Thank you so much.
Thank you.
And you were to share your future plans also, right? You said
Yes,
you said you'll be sharing your future plans also.
Joining the L3 program.
Acha, joining the L3
Okay,
program.
okay.
Okay. So fine. Okay. So one is that. Okay. But personally also, I hope you have a plan, as you already mentioned, that you want to expand now. Okay. Do that. That's a great thing.
Yeah, future plan is like having the chain of clinics, but maybe I need some more time. Currently, I'm focusing on this clinic one.
No, that's a great spirit. Do it. And I hope the others also have learned from her inputs, and parallelly my inputs on how it goes when you are scaling up, right. And I must appreciate her on her discipline, right. That every single point has been mentioned very, very clearly. Mujhe ye batana hai, right. So when you are prepared, you'll be able to deliver better. Okay. So preparation is the secret for a better delivery. Okay. So similarly, if you see the L2 program also, you are entirely prepared now for the delivery of a better care, right. So the moment you have no preparation, you get confused, your confidence becomes lost, okay, and poor, or you do not know how to do. So that's the reason with your lesser potential you work. When you are working with a lesser potential, so definitely results will also be lesser, and your belief system becomes stronger. See, इसमें कुछ है नहीं है, मैंने जो सोचा था वही हुआ, right. But that is not true. Okay. You must work with the fullest potential. You should have the highest belief system so that you get a better results.
One more thing.
Yeah.
I would like to say, I have been really inspired by your Thanksgiving program, and soon I am even planning to like start something like this.
Yeah.
So you people are doing a great job. It's both of you are so much grounded, and you also have mentioned about positive affirmations. I think so once, something like that.
Yeah.
And I mean, I really feel connected, maybe because I really find along with the professional ethic, everything, there is something which is unique in both of you.
Thank you.
You're very positive, and your positive vibes radiates in all your teachings. And along with the professional lessons, you give us life lessons also.
Exactly.
So
Right.
I really appreciate that. And
Right.
thank you so much from the core of
So-
my heart.
Right.
Thank
The
you.
secret is H to H. Okay. People talk about B2B, right? So people talk about B2C. What is that? Business to business and business to customer. Okay. We talk about human to human, right? H to H. Okay. So when you have that H to H feelings, when you have that H to H connect, the one you said, will automatically happen, right? You have something that, helps me to connect to you. Okay. That is nothing but H to H, human to human connect. Okay.
I
So
always
have,
put positive energy around both of you.
correct. So have this human to human connect with with your patients also. Okay. So that they will also feel the same about you, right? Okay. So thank you so much, Vinita, for
Thank
sharing
you,
your
Vinita.
story as such. Okay.
And best
And,
luck for your
wish you
future
all the very
endeavors.
best. Okay. So keep sharing your stories.
Thank you so
Okay.
much.
That's a must. That's a must. Right.
Yeah.